In May 2018, I noted that Babylon had upgraded the chatbot. When I say upgraded, I mean made it even more dangerous. So this is a case of an overweight 20-a-day smoker who's having a barn door heart attack. You know, my 8-year-old would say you need an ambulance if someone presented with these symptoms. The chatbot says panic attack. Around that same time, a case with a typical PE DVT, swollen painful leg, breathless, chest pain, the chatbot suggesting Charcot's joint. Anyone medical in the audience would just realize quite how ridiculous that is. So this story got more interesting. So it was quite clear that the MHRA were watching my Twitter feed, not quite as closely as Babylon, I suspect, but they were watching. And I got an email from the MHRA indicating that those two concerns, the risk of a missed heart attack, risk of a missed PE, were being flagged as incidents. A couple of days later, I sent a further email to the MHRA indicating that I suggest we have a face-to-face meeting to discuss the concerns. I'm particularly concerned that the chest pain triage algorithm is just as dangerous today as when I first flagged it in February 2017.
Ladies and gentlemen, would you please welcome to the stage Babylon's founder and CEO, Dr. Ali Parsa.
Before I start, I'd like to invite our host, Dr. Andrew Goddard, President-elect of the Royal College of Physicians, to come and say some welcoming remarks.
So, good evening, everybody. Welcome to the Royal College of Physicians in our 500th year. We are going to be 500 on the 23rd of September, and I suspect that Henry VIII, when he felt that a college was needed in order to regulate the practice of medicine and remove quacks from within the City of London, what we're about to see tonight was a long way off in his imagination. Now, I'm a...
At the moment, the only system available to the world is the outside ring. We think we can convert that inside out. So we can have a system in which most people can diagnose, can see what's wrong with them at the comfort of their mobile phone. If they need to see a doctor, they press a button and see one within minutes. And then if they need to see somebody physically, they'll go and see them physically. When we do this, what we find is that 40% of our patients figure out their problems and get all the reassurance they need with the artificial intelligence alone. For those who come to our doctors have the results, therefore they can see them 30 to 40% cheaper in terms of the cost, or less time, and therefore 30, 40% cheaper, and only 1 in 10 will go and see a doctor physically. Said, okay, now what if we start reimagining the entire way we deliver healthcare? What if instead of doing it just on your mobile phone, we put it on everywhere you are? We recently announced an agreement with Tencent to put it in WeChat. I see colleagues from Samsung who just embedded it in their phones. 11 million phones in the country now have Babylon embedded, the artificial intelligence. So we said, what if we put your interaction with healthcare on Alexa? So I'm going to show you a little film. It does it on Alexa. It turns Alexa into a doctor. If you could play a film for me.
Hi, Alexa. I want to speak to Babylon.
Hello, Louise. How can I help you?
Well, I've been feeling a bit dizzy recently.
I'm sorry to hear that. Finally, have you noticed that your ears are feeling full or blocked?
Yes, actually.
I think I might know what's been causing your symptoms. It is most likely to be Meniere's disease. Meniere's disease needs a specialist opinion, and might be helped with some medicine to reduce the dizziness, so I'd recommend talking to one of our GPs.
Sure, sounds good.
Doctor.
So that's great. So now you can go and talk to a doctor. Let me show you what a doctor sees. We can fundamentally change the experience of a doctor too. Please run the next film for me.
Hi Louise, my name's Dr. Kultag Archer. Nice to meet you.
Hi, nice to meet you too.
So I can see you've completed our AI assessment. And from this, can I...
So let me explain to you what's going to happen here. By the way, this Alexa thing that you show, it wasn't a show, it's not a demo, it's the reality of what we are going to do. In actual fact, we are going to release the Alexa scale. I see our chief scientist on that area there. Niels, when? End of July? Let's say August. So now, and this one we are going to give to our doctors later this year. It's not live yet, but what you see is live or works. So what the doctors see is they take from the patients the clinical summary. So it's all put for them from history to the family history to in the clinical codes that doctors can immediately digest. They will also have the conversations as it happens with the patient recorded and translated into real things. So everything we have a transcript of. The notes, the doctor's notes, and you'll see that eventually will get automatically generated for the doctors when they finish doing this.
Yeah.
Okay. And does changing the position of your head bring on the dizziness? Sorry, what I mean...
So what you're seeing here is that we're turning on the front camera of the patient or the computer's front camera, and we're continuously analyzing the 117 muscles on the face that do not lie, and we can tell our doctors how the patient feels if they miss it, right? So the doctor now gets a cue that the patient is confused or is worried, so they can react to it immediately. Carry on. This is a real consultation, so that's exactly what happened.
Okay. So I'll send that prescription to your usual pharmacy. It'll take around an hour or so.
Okay.
Does that all sound okay?
It sounds a little bit serious.
Well, as you found out, the symptoms can be really serious when you have them, but Meniere's itself usually isn't, and it can be really well managed with the medication.
Okay, thanks.
Also, what you notice is that the machine is continuously giving suggested questions to our doctors. The doctors can ignore them or can go on with them. But if you're in rural India, you do not ignore that. And later tonight, I have a little surprise for you, so you will see this effect in real life. That's what we've done. That's what we built. None of this is a show. All of this will be either in the market or already in the market. The diagnosis you can already actually do on the Babylon app. That's what we've done. That's what we built. None of this is a show. All of this will be either in the market or already in the market. The diagnosis you can already actually do on the Babylon app. So we built it. We just shared with you what our vision was. We shared with you how we built it. But the question is, how accurate is it? Can it ever be as accurate as a human doctor in diagnosis? Can it pass the tests that a doctor has to sit to pass to become a doctor? So we put the machine to test. we created a series of tests. I won't spoil it for you, but here is the highlight. And I bring Dr. Mubashir Bhatt, our medical director, to the stage.
Good evening, everyone. Thanks, Ali. It's a great privilege to join you here at the Royal College of Physicians for this landmark event in Babylon's history. You've just heard. However, tonight is all about how our AI performs when it comes to diagnosis. So how did Babylon's AI do at its first attempt at the exam questions? At first attempt, Babylon's AI achieved 81%. 81%, ladies and gentlemen, at the first attempt. And I just want to put this into context. It takes most doctors around 12 years before they have the knowledge and skills to sit this exam. And then, even then, some fail it on their first attempt. Some even fail it on their second, third, fourth attempt. It's taken our scientists and clinicians around 2 years, not 12 years, 2 years, to create artificial intelligence that can achieve 81% at its first attempt. And I know you've all just done a round of applause, but I am going to ask you to do another one for my colleagues who've worked so hard to achieve this.
And as what my good colleague Mob said, it takes us hundreds of thousands of pounds, millions, to train doctors over many, many years. We can now do a little bit of that. And we can't just put it in the pocket of the rich, of the wealthy, of the 1%, of the 10%, who have the privilege of living in one of the richest countries in the world. We can do it simultaneously to anyone, anywhere in the world, as long as they have access to the internet. Tonight, they can go on our website and get access to what you just saw. This is the beginning of our journey. We've done only 2 to 3 years of work. We're nowhere near where we're going to be in 5 years' time, 10 years' time. We're going to be in unimaginable places. We're going to not just do that for general practice, but we're going to do it for mental health. We're going to do it for pediatrics. We're going to do it for orthopedics. We're going to make our machine an intelligent tool in the hands of every human being on earth. We're going to then leave doctors, to become human, to spend their time helping those at need, to, as we said, put their hands on their shoulders. Thank you so much for your time tonight. Thank you.
And I want to pay tribute to the work of NHS England in making the system work so that this service has been able to grow to the point it has so far. And I recognise the NHS England senior leadership who are here today, and I'll let you into a secret. I'll let you into a secret, some of them are patients too.
But when you see something which you're concerned could cause patients to come to harm, you flag those concerns. That's what any of us should be doing. That's what I did in 2017 in good faith. In 2018, I offered to meet with the MHRA. I contacted one of your leadership team directly to try and engage. As I say, these chatbots are currently regulated to the same level as a walking stick or a pair of spectacles. There's no approval process. There's no one at the MHRA assesses the clinical validity of these chatbots. In 2017, when these issues first came to light, I reported them to the CQC. They were flagged to the MHRA, as you've seen in the
So
film.
two medical bodies knew that you were concerned about them,
Yep.
and reported them to Babylon.
They took until May 2018, but we're aware that in May 2018, these same issues, that cardiac chest pain and the risk of missing a heart attack, was flagged as a concern. It was flawed then, and it's still flawed today.
You should be thanking him.